Hi guys, welcome back to my channel. In today's video, I want to go over the best types of products for down there to keep things nice and healthy and normal. Mostly after menopause, because when we lose our estrogen, the tissue and the pH is going to change. However, we can also use these types of products that I'm going to be talking about today whenever you have pain with intercourse, vaginal dryness, or recurrent urinary tract infections. So if you're interested in learning about what is going to be the right prescription for you, do not miss this week's video. I'm Dr. Hirsch. I am your menopause doctor here on YouTube. I work at the Brigham and Women's Hospital in Boston, Massachusetts, and I do consultative menopause. So I do this day in and day out. I love bringing the most up-to-date, evidence-based content to you here on YouTube. Now, I did a whole video here back in the past on vaginal dryness, vaginal atrophy, and how to use vaginal estrogens in menopause. And that video is really blown up. It's done really well, but it's so crazy to see how much I've grown as a creator, even over the last year in terms of making videos, production, lighting, sound, all of those things. But I still recommend checking out that video before you come back to this video, because in this video, I'm going to go over the prescription estrogen medications to use for vaginal health. I'm going to go over all the different kinds and types and how to use them, because those are the questions that you guys are starting to send me after you're learning about the safety and efficacy of vaginal estrogen preparations that are prescription. Please take what you've learned here as really good, solid education and chat with your doctor. And before we go any further, the safety of vaginal estrogen has been immensely studied. I'm going to link this article here. This is just one of numerous studies documenting the safety of vaginal estrogen in over 40,000 women who participated in the Women's Health Initiative and following them using vaginal estrogen. And they found no increased risk of breast cancer, heart attacks, strokes, clots. And that is because vaginal estrogen, those local preparations that are just treating genitourinary syndrome of menopause, do not travel systemically. So you're not getting those estrogen levels in your body. Now, I have a lot of people comment and say, how can that be true? This is this is something that has been well studied in randomized control trials, in meta-analysis as well. And a meta-analysis is when they take multiple different randomized control trials and other studies and put them all together. So I promise you, after having, 4 years of residency and 2 years of fellowship in menopause health and practicing menopause for the last several years, reading every study there is on vaginal estrogens, these are completely safe. And no, these videos are not sponsored. I do not get anything from recommending these products to you other than the satisfaction that you have reclaimed your life in menopause and teaching the safety of these medications to you. Okay, let's get into the preparations. In terms of what I perceive to be the most efficacious is the E string. The E string is a small, really flexible ring. It will remind you of a hair tie when you open the package. You pinch it and you're gonna pop it up behind the cervix, and it can sit there for 3 months. You set it and forget it. Now, you know you're doing it right if you can't feel it. You should not be able to feel it. Can you take it out if you need to, or for adult activities? Yes, you can, and then just rinse it and put it back in. Do you have to take it out? No. So the reason I find this to be really efficacious is, again, because it's a set it and forget it. So you don't have to remember it before bed. It's not messy. And for those of you who try it and don't even remember it's there, it works extremely well. Next, in terms of efficacy, are the estrogen creams. Now, you can either do estradiol, and the brand name for that is Estrace, or you could use Premarin vaginal cream, and that's conjugated equine estrogen. Now, they're both very effective, and they both come with an applicator, and they are in a cream form. So how I prescribe this, and again, you're going to discuss this with your clinician, is that I like to bolus the tissue, meaning give it extra TLC if you've had a lot of dryness and pain recently. So how I write for is to use an applicator full every night for 2 weeks. Then use it 2 to 3 to 4 times a week. There is no limit. The sky is the limit because vaginal estrogen does not travel systemically. So sometimes my patients use it 2 times a week for maintenance, and sometimes they use it more than that, 3 times a week, 4 times a week. They find that magic number that is good for them. There's nothing wrong if you used it every single day. You just wouldn't want to. It would be exhausting. But again, you're not going to get systemic levels. So you want to use a maintenance dose, the dose that's going to actually be effective in alleviating your symptoms. Now, I think this is very efficacious. And the other thing that I really like about using the creams is that if you need to take a little dab, a pea-sized amount on your finger, to put it on the outside tissue, the vestibule or the vulva, you also have the freedom to do so because it comes in a cream form. That's something you can't do with the ring because there's no cream, but it's something you can do with the creams. Now, the downside, or what most people don't like, is that they can be quite messy, and what goes up must come down, and what is coming out is just the formula that the estrogen is in. So that estrogen is going to get absorbed, and a lot of times there can be some mess or some discharge. If it doesn't bother you and you find it really effective and you like this method because you can also use it on the outside of the tissue, awesome. But if you don't like it because it's too messy, I'm going to tell you another option that you can use. The next option I want to tell you about, its brand name is called Imvixi. And what Imvixi is estradiol and coconut oil. And it looks like a little jelly belly jelly bean. Now, these haven't been on the market for all that long, meaning in terms of the other options, they've been around for a long, long time. So if you haven't heard of Imvixi or the little jelly bean, that's because it hasn't been around all that long, although it has been on the market for a few years. I definitely love using this, especially for my patients who like inserting something, but they don't like the mess. So you pop this little jelly bean in, and it's really much more easy and convenient. A lot of people say they can even do it in the morning because they just don't have as much mess with the creams, which I usually say to apply at night so that if there's discharge, it will happen in the morning, and then you can clean and go about your day. So Imvixi is a really nice option if you like the estradiol and coconut oil idea and you don't like the mess of the cream. And bonus, Imvixi also comes in a ultra low dose. Now, when do you need the ultra low dose? That's between you and your clinician. Mostly I use the 10 for all of these, but this comes in a 4. The 4 is the unit, so it's just a lower dose. This might be great for someone who's extremely sensitive. If you took vaginal preparations and you even did get a little bit of cramping or bleeding, you could try the ultra low dose, or if you just prefer that idea. But again, vaginal estrogen, I cannot stress how safe and effective it really is. The next options to consider are the suppositories. So the brand names for these are either going to be Vagifem or Uvafem. These are little suppositories, i.e. little tablets that you're going to use with an applicator to put in the top or the back or the upper part of the vagina. Now, I'm going down in terms of tiers of efficacy because I do find these to be anecdotally, in my opinion, less efficacious than the creams, and also less efficacious than the ring. Remember, the ring, you said it, forget it. The creams, you can certainly, fall out of doing that, forget to put it in at night, not like the mess, and then never go back to your doctor again to come up with something else. So the suppositories are absolutely great if you're going to be if you need to do something, maybe that's what your insurance will cover. These are really nice options. Now, typically, again, they're written as twice a week suppository, but just like I said with the creams, you can use them more than 2 times a week. If you find for you that you need to put the suppository in or the little tablet 3 times a week or 4 times a week, you can talk to your clinician about that and they can write it that way. So these are really nice options. I find them, again, to be the least efficacious just because, number one, just like the cream, you gotta remember to do it. You can absolutely forget. You might not like the idea of an applicator, which if you don't like the idea of an applicator, think about the estradiol and coconut jelly bean option that I talked about before this. And the other thing about these is that because they go up to that top of the vagina and you don't have the cream like you do with estrace and the Premarin vaginal creams, you can't really put any dabs on the outside. Now the dabbing on the outside is really helpful, especially if you have pain initially. If that pain is initially on penetration, then you might want to use the creams so that you can put a little dab on the outside. Before I go any further, I actually have a patient who uses the E-string. She loves it. She puts it in, she sets it and forgets it. And I also have given her a script for the cream so that she can use the cream not actually intravaginally, but just put a little bit on the outside of the tissue, and that really helps with that part of the pain that she's experiencing. So can you sort of think outside the box? Yes, you can. Lastly, there's another option on the market that's actually not estrogen, but I put it in the estrogen classification in my mind, and it's called progesterone. Progesterone's brand name is Interosa, and this is vaginal DHEA. I get a lot of questions about this, and it's a product that I love. It's such a nice option. Now, DHEA is something that converts deep in the cells into estrogen and androgens, which then, androgens can go on to become testosterone. Now, these are, again, not systemic. It's local treatment only. And that tissue is responsive to both estrogens and androgens. So this is a really nice option. And that conversion happens through a long-winded pathway deep in your cells. Interosa is a nightly suppository. It's a really nice alternative to estrogens. Say you've tried them, they haven't worked for you, or for some reason you just wanted to try something that's quote unquote not estrogen but is DHEA. This is a really nice option, and again, that one's called Interosa. So it's a suppository, and this is written as nightly. If nightly is too much for you, I always tell my patients you could go again at whatever frequency that you like. If you want to do it every other night or most nights, we want to make sure that it's working. It's doing what we're setting it out to do. But with all of these things, there is a lot of wiggle room. I know that was a lot of information all at once, but if you found this video helpful and is guiding you on your journey, let me know down in the comment sections below. I love hearing what you guys have questions on, or what else you would like to have me make videos on. I love this channel. I love that we're growing. So if you found this helpful, if you gleaned anything from this, please subscribe to the channel, because we are telling YouTube that this is where everyone who is going through midlife, menopause, the transition should be. So I thank you so much for your subscription. If you've been watching a bunch of my videos and you haven't yet subscribed, go ahead, try it out. You can always unsubscribe later if you want to. If you guys aren't already following me on my social media platforms, please do, because I love reading all your DMs, your comments. It's really where I get so much of my inspiration to make these videos for you. I learn what topics you want. I learn what questions you have. And while it's a little overwhelming to respond to all of them, I read every single one of them. On Instagram, I'm at hormone.health.doc, and I am on Twitter at HeatherHirschMD. Thank you guys again so much for sticking around, joining the community here on my channel, and I will see you guys next Monday for a brand new video.